Did you know that reducing your intake of alcohol and tobacco can reduce your risk of fracture? Hi, my name is Anita Kaiser, and this is episode 2 of the Bare Bones podcast, Fractures 101, where we'll talk about fracture risk and fall prevention. Joining me is my colleague Wendy Murphy, who has over 30 years of experience living with a spinal cord injury, and our guest, Dr. Laura Carbone, a physician at the Charlie Norwood Veterans Affairs. Welcome to the show, Dr. Carbone.
Thank you very much for having me.
So maybe we can have you start off by explaining why it's important for people living with a spinal cord injury to learn about bone health.
Bone health is very important because it allows people to participate in activities, and optimum bone health is important to reduce fracture risks. Fractures are actually common, unfortunately, in persons who have a spinal cord injury, with upwards of 20 to almost 50% of people over a lifetime perhaps suffering from a fracture. So, knowledge of one's bone health is important so one can identify their individual risk factors for fracture and work on changing this.
So, why is it important to assess my risk factor?
Everyone's risk for fracture is different. So, it's important to assess your own individual risk for fracture so that you can know what they are. So, you can say, this, I am at high or maybe low risk for fracture. And these are things that I could potentially change.
So thanks for explaining the importance of why we should be getting our fracture risk assessed. How often should we have our fracture risk assessed?
You should have your fracture risk assessed shortly following your injury and then yearly. You should also have your fracture risk assessed if you think your risk is changing. So, if you started a medicine that might be associated with more fracture risks, as an example, or following a fall, particularly if the fall was an injurious fall, following a fracture, or if there's been a change in your functional abilities.
Now, tell me, doctor, how is my risk of fracture determined?
We can easily determine your risk for fracture. So there are two ways. One is what we call clinical risk factors, and we'll be talking about modifiable versus non modifiable clinical risk factors. And these are things about your medical history and your personal medical information. Then the other is a very important test called a bone density test. It's done by a machine called the DEXA. So sometimes you'll hear it called the DEXA test. And it's important to have this test done. It's a very simple test to do. It's very little radiation exposure. It's kind of like having an x-ray without as much radiation exposure. And what they'll do is measure how thick or thin, depending on how you want to look at it, your bones are. And this test is measured around your knee. So it's measured specifically right above your knee at your distal femur and right below your knee at your proximal tibia.
Thanks. So I know you mentioned that there's different types of risk factors. What is the difference between modifiable and non-modifiable risk factors? And what would be your recommendations to managing these modifiable risk factors?
Well, that's a really good question. So, non modifiable risk factors mean something that you can't change. So, there are non modifiable risk factors for fracture. For example, certain things related to your spinal cord injury. As an example, how long you've had it. The longer you've had it, the greater your risk for fracture, the level of your spinal cord injury, aspects of your general health. For example, do you have rheumatoid arthritis or not? So those are examples of things that are not modifiable and are risk factors. Example of modifiable risk factors, and I like to think of modifiable as something that I could change myself, are things like you smoke, because that's bad for your bones and you could change that. You're drinking too much alcohol. And then certain drugs, it may be that certain medications you're taking, maybe you have to talk to your physician. You could change to a medicine that was a less risk for fracture. So that's what we consider as modifiable. And a very important modifiable risk factor is also your level of physical activity.
Some really great insights. Now, as a person living with a spinal cord injury, what aspects of my medical history are important to consider when thinking about my bone health?
Well, as you know, knowledge is really power. So, what you want to know from your medical history are things related to your spinal cord injury, as we said, like the duration of your spinal cord injury, and things about your medical history. Specifically on your medical history, you want to know what medical conditions do I have that are associated with fracture risk. We said rheumatoid arthritis is one. Another good example would be someone who has diabetes. And then you want to look at all of your medications and say, am I on a medication that's associated with fracture risk? And we'll talk a little bit more specifically about that later. But then you want to say to yourself, well, am I smoking? Am I drinking? We talked about that as modifiable, but those are also aspects of your medical history. And finally, a very important thing that you should know about your medical history is there a family history of osteoporosis? Is there a family history perhaps of a hip fracture?
Now, doctor, I'm interested to know, are there special considerations for males and females?
There actually are. The point I'd like to get across is that while women are at higher risk for fracture than men, men are still at risk for fracture. And sometimes fractures can be very devastating for men as well. So that's one thing to understand, that both are at risk for fracture, women a little bit more. But then if one looks specifically among women, what do we need to consider? Well, here we consider things related to estrogen predominantly. So we'll ask you about, for example, how old were you when you had your first period? Have you gone through menopause? How old were you when that happened? A lot of times following a spinal cord injury, people will lose their periods for a while, but did they come back? Are they regular? Because it turns out the less exposure you have to estrogen in your life as a woman, the higher your risk for fracture. So someone who had their first period at like age 18 and maybe had very irregular periods and maybe went through menopause at age 40, is at higher risk for fracture than someone who had their period at age 12, had regular periods, and then had menopause at age 52. Now, in men, they don't undergo menopause the same way as women do, but there also is with age and also with spinal cord injury itself, especially from some medications that are taken, there's a loss of testosterone. So you'll see us with men will actually measure testosterone levels. And it can be in some men that this is a modifiable risk factor, and your doctor may choose to talk to you about what you can do about that.
That's some great information. And you kind of just touched on my next question, but are there any medications then that could increase my risk of fracture?
There really are. And I'm going to highlight a few that I think you should know. And if I had to only pick one, I would pick corticosteroids. Sometimes people will call this prednisone. Sometimes people will say it's a Solumedrol or Medrol dose pack. Steroids are really bad for the bone and increase your risk for fracture. So that's one. There's other medicines you might be taking that maybe you can't change. Maybe you can. You need to talk to your doctor. But anticonvulsants that you might use for chronic pain, like opioids, drugs that might increase your risk of falling, a concept we'll talk about a little bit later, like benzodiazepines or medicines for sleep. And then medications, if you are a woman and have breast cancer, there's a medicine that you might be taking to really further reduce your estrogen. And that's also a big risk factor for fracture. There are others. So really looking carefully at your medication list is important.
So tell me, doctor, why is it important to assess my risk of falling?
Well, that's really important in this conversation. And the reason it's important is because falling is what leads to fractures, whether it's a transfer related fall or a fall from standing. Those are predominantly what lead to fractures.
So, how can I or how would you determine my risk of falling?
So we said earlier that it was really easy to determine, your risk for fracture based on bone density and clinical risk factors. Your risk for falling is a little harder to tell, but it can be done. The best way I would suggest is if you have access to a comprehensive spinal cord injury rehabilitation center where you can work with a therapist who can comprehensively assess your risk of falling and look at, for example, how you transfer from a wheelchair. If you're using a standing device, are you using it correctly? And then yourself, are you falling? Are you fearful for falling? Because that's another thing that can actually lead to more falls because you're afraid to fall and then something happens. So I would definitely say that having a comprehensive assessment is important, and especially have a new assessment if you have had a fall, particularly an injurious fall.
Now, this question I'm sure is for many listeners. What can one do if the risk of falling is high?
So we're going to say you've identified that your risk for falling is high, and perhaps you've actually had a fall. So what you can do is you can, in these evaluations, you can identify things that you can change. So as an example, if I'm using a wheelchair, am I using it correctly? Is it fit for me? Do I know how to transfer most safely? If I'm using a walking device, am I using it correctly? Are there barriers in my home that may be increasing my risk for falls? So you can modify your risk for falling. And that's a very important message because of everything, we really want you to try to do this.
Now, does this differ between someone who is a wheelchair user versus someone who ambulates or walks?
So falls are going to be a main cause of fracture, both in someone who is able to ambulate and someone who's using a wheelchair. The mechanism may differ slightly. So if you're ambulating, for example, and your muscles are weak, you might be falling from a standing height. Where someone who's using a wheelchair, a lot of the falls that happen in wheelchair users are actually transfer related falls.
Thanks very much, Dr. Carbone, for this fantastic information that you provided. So I think as a final message, what is the one piece of advice that you'd like people with spinal cord injuries to remember?
So what I'd like to leave you as a take-home message is to know your fracture risk and act to change your modifiable risk factors.
Thank you. So if you found today's talk interesting, check out our action planning tool on the website at www.seifragments.ca, and feel free to send us your feedback using the survey provided on the website. In the next episode, we'll talk about the importance of blood test screening.